Okay. Hello again. Good evening. Um, my name is Joseph Anthony Brown. I'm your student nurse for today from the Adventist University of the Philippines. Before we start, I was going to ask you, have you been feeling any allergies or have you had any allergies lately?
Yeah, actually, I've been my nose is full as of this moment, so I think that's a sign
Okay.
or symptom.
All right. And how long has it been going on for?
This has been going on for most of my life, ever since
Okay.
youth.
Okay. And what symptoms um do you usually feel before the onset of allergies?
Well, I think I would describe it is my nose starts, the nasal cavity starts getting smaller, so I can't breathe on one nostril, and on the other it starts filling up with mucus.
All right, so before we start, I just want to do a quick prayer if that's all right. All right, so dear God, thank you for this opportunity to help the guide, to help and guide. Please grant me wisdom and clarity as I share this information. Help my client to understand and feel encouraged on their path to healing. May they find strength, patience, and hope during their recovery. Bless our time together and guide us toward health and wholeness. Um, en el Padre, el Hijo, Espíritu Santo. Amen. Um, okay. So before we begin, I was gonna send you just a little short quiz just to see how much you know about hay fever. Okay. So I'm gonna send it to you right now. Okay, I just sent it to you. Do you see it?
Yeah, I'll answer it.
All right. All right. Just let me know when you're done, okay?
Okay. I'm done with the test.
All right. Thank you so much. I'm gonna check it later, okay? So the title of our presentation is the nose knows inside hay fever. So some of the objectives that I think we should be working on towards is I'm gonna be by the end of this you should be able to define hay fever, which is also allergic rhinitis, and distinguish it from infectious rhinitis. describing the function of the mucous membrane in the nose and its role in allergic rhinitis. We're going to identify common triggers of allergic rhinitis in the environment and workplace, recognize key symptoms of allergic rhinitis, and understand the use of symptom diary. Also explain the immune system's response and the role of histamine in allergic rhinitis. Also outline diagnostic methods, including history, physical exam, and allergy tests. And also summarize standard treatments, trigger avoidance, medications, and immunotherapy. Discuss alternative and home remedies, highlighting the importance of consulting healthcare providers. List effective prevention strategies for managing allergic rhinitis, and describe the impact of allergic rhinitis on daily life and potential complications if untreated. So, hay fever unmasked. Hay fever is nasal inflammation caused by the immune system. So it's usually just overreaction to like foreign allergens like pollen, dust, or pet dander. These symptoms can include like sneezing, runny, stuffy nose, and itchy eyes. Um, it's not contagious, but it is, and is different from the common cold. Um, Usually like when this happens, not like you're sick or anything, but it's just like the nose's natural defense is like on overdrive and overreacting. The nose is lined with mucous membrane that filters and humidifies air. In hay fever, this lining becomes inflamed after allergen exposure, leading to swelling, sneezing, and extra mucus. Like this, I think this image I have on the right side, like this is how the inner, how your nose looks inside. And like usually like it gets all like covered in mucus. So on the left side, we'll have a healthy nasal mucosa, and on the right side is an inflammation of rhinitis. So these are like the different types of what like these are different type of things of what sets off hay fever. So some of the major triggers include pollen, trees, grass, weeds. We usually have pollen, dust mites. So like it's very like dust mites, those are, like that's why they really recommend to wash your linen in your bed like once a week because dust mites build up, and if you have allergic rhinitis, it could make it worse. Pet hair or dander. Do you have any pets?
Yeah.
Yeah. How many pets do you have? What kind of pets?
We have two cats.
Two cats. Okay, okay. And also mold and workplace substances like chemicals and dust can be major triggers. Bleach, uh, perfume, cologne, stuff like that. I know you told me you had pets, so that can possibly be a major trigger to your to hay fever. So you should take that into consideration sometimes. And these are just spotting symptoms and tracking triggers. So some of these key symptoms, including sneezing, running stuffy nose, itchy, watery eyes. It can make you cough. Um, you'll probably feel sore throat, headaches, and tiredness can also be symptoms. And so you could be making a symptom diary to like note some of these symptoms that you're feeling. So, what is a symptom diary? So, it's a detailed record that a person keeps to track their symptoms they experience, including their severity, timing, duration, and any related factors such as medication use or potential triggers. And if you're thinking about like why does our bodies react like this, some of us, it's just allergic rhinitis occurs when the immune system mistakes harmless substances for threats. So it's like it's histamine and other chemicals are released, causing inflammation and allergy symptoms. So getting the right diagnosis is like So doctors review symptoms and medical history and conduct the physical exam and may order allergy tests. We can test for allergies in the skin or blood. These tests help identify triggers, but are not always definitive. So managing hay fever, some of the medical approaches is avoiding known triggers, medications like antihistamines or nasal sprays. So when I was younger, I used to have a nasal spray, which helped me a lot. And we have there's allergen immunotherapy for severe or persistent cases. And other ways to manage hay fever is exploring home and alternative remedies. So using saline nasal rinses clear allergens and reduce mucus. Herbal options like turmeric, vitamin C, ginger tea. Like turmeric contains curcumin. It's a powerful anti-inflammatory and antioxidant that may help reduce nasal mucosal inflammation when consumed regularly. Vitamin C acts as a natural antihistamine and antioxidant. So, it's helping you to reduce allergy symptoms. So, drinking orange juice is very good for you. Um, Ginger tea has anti-inflammatory and antiviral properties that may help clear mucus and soothe irritated nasal passages. So, so what do you do for any remedies that you do while you have allergies?
I don't really have any remedies. I just wait it
You
out.
don't really have any? Okay, okay. You don't want to take any medication for that?
Not really.
Okay, okay. So exploring home and alternative remedies, we have alternative options. We have aromatherapy and acupuncture. So inhaling steam with essential oils like eucalyptus or peppermint, lavender, tea tree, or lemon can help open your nasal passages and reduce inflammation and ease breathing. Some traditional Chinese medicine practice that involves inserting very thin needles through the skin at specific points on the body. Yeah. Have you tried any of those?
I've done the steaming
You've
and
done the steaming?
acupuncture.
Yeah, see, I've done that too. Did it
Steaming
help you
helps.
use the steaming? It helped out?
The
Okay.
steam, the acupuncture, I didn't really notice anything different.
No. Okay, okay. So I actually have this video that I want you to watch. It's how to use a neti pot correctly and nasal saline irrigation at home. I'm gonna just send this video to you, and it's something like this. This is my own personal, since I also have allergies, and usually I just use like mineral water or distilled water, and I'll mix it with this nasal rinse mix, and like I use this, and this helps. So when I use it, it actually helps irrigate my nose a lot of the times when I'm going through it. You can easily buy it. It's very affordable. You can easily buy it on Shopee. Um, okay, so I'm gonna send you this video. And, we're gonna watch this together. Okay.
Your saline nasal rinse can be used for a runny nose, a stuffy nose, congestion, caused from things like a cold, flu, allergies, and loads more. And if you've just purchased my Neti-Pot sinus rinse bottle from Amazon, it's time to use it, how to do the saline rinse properly for maximum benefit. So let's begin. Step number one, do not waste your money on expensive salt sachets to make your saline solution. You can easily make your own saline solution at home with common non-iodized powdered salt that we all use at home. It is super easy to do, and that's why we don't include those salt sachets with your Neti-Pot sinus rinse bottle, because you can do it at home. And here's how you do it. Kettle, water, boil, Container, 1 teaspoon of non-iodized powdered salt. Add 300 ml of boiled water. Mix. And your saline solution is now ready. Now remember, when you make your saline solution, you must always boil the water. And also, you need to let this solution cool down to a tepid temperature before you add it to your sinus rinse bottle to prevent damaging it. Lastly, whenever you make your saline solution, you need to make a fresh batch. Don't use this later on, okay? You can't do that. Now let's dive straight into step number 2, getting ready. Stand over a sink, blow your nose, wash your hands, and then fill your neti pot sinus rinse to the 300 ml mark sign with your saline solution that we just made, and then close the lid. We can move on to the next step. And step number 3, rinsing the nasal passage. We're going to start with our nostril. So you're going to tilt your head forward like so, towards the left. Make sure you leave your mouth open slightly because you're going to breathe in and out from your mouth only when you're doing the nasal rinse. Hold your neti pot sinus rinse bottle upside down like so. Maintain the mouth open. I'm going to move into a voiceover in a second, but what you're going to do is you're going to put the tip firmly in your right nostril and then click the valve like so. So observe, tilt forward to the left, stick this in like so, and let's go. Press and hold the valve to initiate the flow. You need to remember to continue breathing in and out of your mouth as you normally would do. You're going to see the saline solution flow through your nasal passage and out of your left nostril. That's why we do it this way, so gravity does its work. Use half the solution, then release the valve, stop. Diving straight into step number 4, right nostril now done. Now before we move on to the left nostril, you're going to have some residual solution left in your nasal passage. Super normal, very normal for this to happen, and you've got 2 options to get rid of it. Option 1 is you get a tissue, you grab a little bit like so, and you've got super gentle. I can't emphasize how gentle you have to be, so don't pinch your nose completely, very light grip like so, and just blow very softly. If you blow forcefully, you are really going to hurt your ears, and you don't want that, so it has to be super gentle. Option 2, of it as well, just a snip up very gently like so, just like that, and you'll get the residual solution going into the back of your throat, and you can just spit that out. So that's the 2 options. And for the left nostril, we are going to repeat step 3. The only difference is we're holding the device in our left hand this time. So again, though, we're going to tilt our head forward, but this time we're going to tilt to the right, okay? So we're going to put the device in our nostril firmly, and I'm going to do a voice over again. So let's go, and don't forget to breathe through your mouth. So press and hold the valve to initiate flow. You're going to see the saline solution flow through your nasal passage and out of your right nostril. That's why we tilt this way, so gravity does its work again. And use the remaining solution, then release the valve to stop, and you're done. And now we can repeat step 4 to get rid of any residual solution we have left in our nasal passage, and that's it. Job done, well done. It takes a bit of practice, but you'll get the hang of it in no time. Now, generally speaking, the neti pot sinus rinse bottle can be used once or twice a day, or however often as you need for symptomatic relief. After using it, you can give it a wash with warm soapy water. I've already washed this, but the main thing you've got to remember is you've got to just leave it to air dry like so. Now, my neti pot sinus rinse bottle is available on Amazon worldwide. I'm going to leave links to it.
Right. So some smart prevention strategies. So we can stay indoors when pollen is high, use air filters and keep windows closed, wash bedding often and avoid known triggers like pets or dust. So do you carry your pets often?
Yes, very often.
Yeah, I'm sure you do. So, hay fever. So some of these treatments also for hay fever remedies to cure allergies. I have another YouTube video that we can watch. Gonna be the same guy.
Hey guys, welcome to this week's video. We are talking about hay fever or allergies, whatever you want to call it. It's spring, it's summer, the birds are singing, the bees are flying around everywhere, and the pollen levels are really, really high. And I'm sure a lot of people will be suffering from these allergies or hay fever, whatever you want to name it. So in this video, we're going to talk about hay fever, its treatment, what you can do to help with symptoms, and what you can do to help prevent those symptoms. So let's begin with the foundation stuff. Let's begin with the body parts. Let's start with the eyes. If you've got itchy, runny eyes, whatever symptoms like that, hay fever type symptoms, remember that itching them or rubbing them is only going to make it worse, okay? Pollen is microscopic, so it'll be on your hands, it'll be on your clothes, and if you're rubbing your eyes constantly and not washing them, it's just going to make it worse, and you're going to get this feedback loop that's just making things worse, and you're constantly doing it. So please, please, please try not to rub those eyes. That's one of the most important things, but now let's talk about the treatments. Okay, so step number one, the first thing you need to do if your eyes are really, really itchy, okay, and they're really making you annoyed, okay, is you need to do a cold compress. Now, you can buy eye masks that you put in the fridge, but that's a bit difficult if you don't have it, because I'm sure you want to do something straight away. Another easy option is to get some cucumbers. Cucumbers, you probably keep it in the fridge, cut them up like you see in the movies, lie down, close your eyes, and put them on top of your eyes, okay? This is just going to give us that immediate relief straight away, so that cold compress effect, but without having to buy something. Now, another home remedy type of thing that you can do straight away is putting some Vaseline underneath the eyes, okay? What is this going to do? Well, first of all, it's going to pick up those little pollens that are microscopic that we can't see. They're going to stick to the Vaseline, so it's less likely for it to go in your eyes, so that's a good thing. And secondly, it's probably going to deter you from rubbing your eyes all the time, okay, which, like I said, is just going to make things worse. So those are two quick things that everyone can do at home. Okay, so when it comes to treatment for the eyes, my go-to eye drop is sodium chromoglobulin. Okay, I think it's quite inexpensive to buy. It's always available from most chemists, and it works really, really well at stabilizing the mast cells that are in the eyes that release the histamine and make things worse. One thing to bear in mind, if you've got runny eyes and you're producing lots and lots of water, they're constantly flowing, okay? If you're going to put an eye drop in, it's probably not going to work. It's just going to get flushed out, okay? So my top tip, if you're going to use the eye drops, is make sure you're doing a punctal hold, okay? Punctal hold is basically holding this bit here of the eye, so it stops it from draining. So when you put your eye drop in and you close your eyes, you need to do a punctal hold, okay? Just so it gives it time for it to absorb and stick to those mast cells and prevent them from releasing that histamine. Now, if you want more information on how to use eye drop, I do have a few videos on it. I've got a really good video on it, actually, that I'll leave up here and in the description below. So please, please, please make sure you watch that video, because you need to know how to use eye drops properly to get the most out of it. Because if you're not using it properly, it's pretty worthless and you're going to be very disappointed from the effects. Okay, so next up, I want to talk to you about the nose, okay? Otherwise known as allergic rhinitis, probably one of the most common symptoms that you get with hay fever or allergies, whatever you want to call it. That runny nose, constantly having to blow your nose, okay? And that is basically very, very common because we're always breathing in and the pollen goes in, which then causes that reaction that we spoke about, which is causing those symptoms for us. So the next question is, what should you do about it? Well, step one, we're going to go back to Vaseline, our good friend, okay? It's cheap, it's inexpensive, easy to use, and I'm sure a lot of you will have some Vaseline at home. First thing you need to do is just rub some Vaseline around the nose. You can put it inside a little bit as well, completely fine. Obviously, make sure it's on children, but this is just going to help catch that pollen to help reduce it going in as much, which is causing those symptoms for us. So this is a really quick hack that everyone can do. So that's the first hack, but what about treatments, okay? We can look at nasal sprays next, okay? Nasal sprays can be broken into different categories, so they work in different ways. First of all, we've got steroid nasal sprays. Steroid nasal sprays are really, really good for allergic rhinitis and hay fever symptoms. However, you need to bear in mind that they take about 2 to 3 weeks for their full effect, okay? So what does this mean? Well, this means if you've got hay fever right now, it's not going to be that effective for you, okay? You need to give it a bit of time for it to become fully effective. So don't become disheartened if you just start using it and you're like, it's not giving me the immediate relief, okay? So preferable thing is if you know your hay fever, gets worse, let's say in July, for a month or two, you need to start using it, a month before your season starts, okay? That way, you're going to get the most benefit out of your steroid. Now, another type of nasal spray which can be quite useful, especially at drying up the nose and just helping with those runny nose symptoms, is a decongestant nasal spray. And the problem with decongestant nasal spray is, yes, it works quickly, but it can interact with a lot of medicines. It can sort of not be appropriate for certain patients. And also, you can't use it long term, okay? You shouldn't really use a nasal decongestant for more than 7 days maximum, okay? Because it can cause something called rebound congestion. So basically, it makes you congested if you use it for longer than that. So make sure you speak to your healthcare professional about it if you're interested in it. But out of the two, I would always go for the steroid nasal spray. Now, moving on to the next type of nasal spray, barrier nasal sprays, okay? These are relatively new to the market and they work in a similar way to how the Vaseline works, okay? They're causing that barrier and they're going to stop the pollen from going in. They can be quite effective, but out of the three so far that we spoke about, if I was to rate them, if you want immediate relief, decongestant ones can be really good. But if you're going to use it properly, the steroid nasal spray, I would always go for that one first. And this barrier one, I would probably put it third or even fourth. Okay, let's move to the next nasal spray. So the next nasal spray is something called a saline nasal spray. Saline basically means salt water, okay? So it's a saltwater nasal spray that basically cleans the nasal cavities and it's going to help sort of restabilize the cells there, really. So we're not reacting as much to pollen, but it also cleans the area from the pollen. These can be quite effective, but obviously not that effective compared to the nasal sprays that we spoke about. But also, if you don't want to buy a nasal spray, which is the same one, you can make one very easily. Okay, you can do some nasal douching, which I spoke about in quite a few of the videos, but it's very easy. Just boil the kettle, let it cool, get a teaspoon of salt, throw it in a cup, pour your water in, mix it in. Obviously, make sure it's not too hot, let it cool, and then basically stand over a sink because it can be very messy and sort of suck it in and then just let it pour out. Okay, don't suck it in too much, but if it does down your back of your throat and it goes into your stomach, it's not an issue either, but try not to do it as much. This is recommended for adults, obviously, but it can be really good at sort of helping stabilize the cells and to clean the area so you're not getting as much symptoms, because remember, it's that buildup of pollen that's causing these problems. Now, I think one of the most important things when it comes to a nasal spray is using it correctly. Just like the eye drops, when I said, if you're not using these correctly, you're not going to get the benefit from it. So I do have a video on how to use a nasal spray properly, which I will leave a link to up here and in the description below. So please, 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 if you haven't.
All right, so those are just some ways to treat allergic rhinitis and some remedies for hay fever. So these are just, some pointers on living well with hay fever. Most people manage symptoms well with treatment. It can impact sleep, work, or school. An example for me is sometimes at work, or when I'm at school, my allergies would be like just acting up a lot, and just very inconvenient. Some of these complications can be sinus infections, worsening of asthma. Empowerment begins with education. It's up to us to like take charge of your to take charge of your allergy and reclaim your comfort. So there's a little prayer that I had from Exodus 15:26. It reminds us of God's healing nature. For I am the Lord who heals you. From Proverbs 17:22. It teaches a merry heart does good like a medicine, but a broken spirit dries the bones. Thank you so much for listening. Do you have any questions? Any
I
concerns?
don't have. Everything
Okay.
was clear. The
So I was
videos
actually
and
gonna send you. I was gonna send you a quick just a little quiz, a little test, just to see how much you've learned from this education. Okay, I'm gonna send it to you right now.
okay,
Okay.
I'll answer it.
All right. Thank you. Thank you.
I'm done with the short quiz.
All right. Well, thank you so much for watching and just listening to my presentation. I really appreciate it. Um, just wanted to say good luck on your healing, and I hope this was very educated for you. Um, thank you so much. Okay, so
Thank you.
goodbye.
Bye.
Bye. Have a good day.